Dear friends, welcome back to the second part of Plato's cave. What we learnt in the last lesson was that all our knowledge and information actually derives from sources which are simply projections on the wall. We must delve deeper, we must examine, and we must continuously educate ourselves. In the second part, which is being presented now, we shall be taking a look at a case study. I'm reminded of a very famous quote by the American author Mark Twain, who said very sarcastically that I have never let my schooling interfere with my education. What he means to say is we must continue with our education. It doesn't finish with schooling. Even though you have graduated in medicine, done a postgraduate or even a doctorate, as an allopath, you must continue with your education and you must expand your horizons. This particular case is a clinical case. There are two people who arrive in the ER department complaining of chest pain. They were previously healthy and they are almost like each other. They are about the same age, from the same ethnicity, same body mass index. Everything appears to be almost same, and even their complaints are similar. They arrive simultaneously in the emergency department complaining of chest pain. That is identical in nature. Let us see what are the findings. We shall call them Mr. A and Mr. B. In the case of Mr. A, he has a normal ECG, but his blood troponin levels are elevated. And as all of us know, that is the most sensitive and specific biomarker for myocardial injury. So he is given a diagnostic label or a diagnosis of acute myocardial infarction. In the case of Mr. B, who goes to another physician in the ER department at the same time, but in a different room, he is also put through the same tests and he is physically examined, and his findings are an abnormal ECG, and we shall see what was the abnormality shortly. It is the lateral ST segment depression, and he has also got a slightly elevated troponin. He has been diagnosed with unstable angina or angina. What does that mean? First of all, take a look at his ECG. On the left is the normal ECG, and on the right, as you can see, there is a slight depression in the ST section. Continuing further, both of them they are admitted to the cardiac care unit. They both undergo a cardiac catheterization the next morning. Both have identical 80% stenosis in the left anterior descending coronary artery. If you look at the graphic on the left hand side of the slide, what I have just circled shows the left anterior descending artery. So both of them are given a drug-eluting stent which is placed in that artery, and both of them go home after 48 hours. And everything is very nice, like a good happy ending. Both of them remain symptom-free thereafter. Story ends very beautifully, very well managed, and as we see, very well diagnosed. But is that really the case? Or are we in the situation of the Plato's cave? Let us see that. How is it that there were two physicians with two different perceptions? The presentations were identical, they were managed in the same way, they had the same outcomes, and they had different diagnoses. So who is more accurate? As you can see in the picture on the right hand side, it is difficult to say whether what these two physicians are seeing is a 6 or a 9. That confusion is simply arising because of the different positions or different sides which they are standing. Now, how does all this matter? We had a very happy ending. Does it matter anymore? Let us see. Patient who was diagnosed with myocardial infarction was an airline captain. And because of this particular diagnosis, he's going to lose his job. He can't stay at the control wheel of an aeroplane any longer. He goes into depression, probably faces a divorce, loss of friends, and he may even end up with addictions. One simple clinical label, and it was a descending staircase thereafter. This person is going to never be the same again, ever. So these are the unintended consequences. Even though on paper it appears everything has been perfect, what are the puppets and what are the shadows that we are seeing on the wall? There are other unintended consequences as well. For the physician, it's a better reimbursement for an acute myocardial infarction. The patient gets a better reimbursement from insurance than he would have got if it was simply classified as an unstable angina or a chest pain. And indeed, all our statistics, record keeping, and insurance forms and everything else is going to change for the purposes of keeping records and statistics. What this story tells us is that we need to educate ourselves at every moment, and we must have the humility to learn. In this particular course, if you can just show that humility and open your heart to understand what homeopathy is about, you are going to gain tremendously in your success in the clinic, simply by shifting a change in your attitude. That is what homeopathy is going to teach you. You may or may not practice with homeopathic medicines, but if you can think homeopathically, you will be like the bamboo who is going to grow higher, and you're going to bow deeper if you are humble, and you're going to achieve greater success. For starters, let us accept that we physicians will never have perfect or complete understanding of the patient or his disease. It's never possible. It's so complex. At the same time, a stethoscope, a radiograph, a computer screen displaying test results, these are all shadows of health. They are exactly like the images that the prisoners are seeing on the cave in Plato's allegory of the cave. It's a deep philosophical question, but as medical students, as practicing doctors, as specialists, we never give thought to that. Let us keep our mind open. Now it is time to ask some questions. How useful do you find the symptoms in reaching a diagnosis? Or do you only go by signs and by reports from the laboratory? Ask yourself this question. We are taught in our medical school about the importance of case taking and recording every single word of the patient in his own language. Are we doing that? Are we paying attention to the symptoms? Because symptoms are telling a much bigger and deeper story than the test reports. Ask yourself, do blood tests or imaging alter your diagnostic perception? Is one doctor right and the other wrong in the case that we just saw? And as we saw, whatever their perceptions were, they had a major impact on the life of one person. Is it possible that both doctors were right and wrong? Now, these are philosophical questions, and I'm sure you're mature enough to question and find the answers yourself, even though it has not been taught in your medical education. Here are some more questions. How can you be certain that medical information is an accurate representation of reality? Since medicine is both an art and science, as a science it will always be updating itself. The data that was found to be apparently good is going to be turned over its head in the next few years. But even before it is turned upside down, as doctors, as physicians, as medical practitioners, or even health workers in any capacity, we must always understand and accept that medical information is not an accurate representation of reality because it is just another shadow on the wall of the cave. Another question is, can you trust your own senses and experience? Because this experience of yours is building up over the course of years, decades, or even more. But at the same time, are we gathering the correct lessons? Friends, thank you very much for your attention. I hope you shall think about it and you will continue with this course just to change your perspectives and to expand your horizons. It's not unfashionable to call yourself a healer. A doctor is just a designation. A healer is your calling. It's a vocation. It's what you give back to society. So thank you very much, and we shall meet once again in the next lesson. Until then, bye bye.